my name is Abhishek and welcome back to MBBS Treasure channel. In this video, we are going to describe another part of the barometric pressure. In my previous video, I have already explained how the decreasing in the barometric pressure causes the pathological action. Now, in this video, we are going to describe how this increasing barometric pressure will cause the pathological action. And we have already discussed that decreasing and increasing of the barometric pressure is totally dependent upon the altitude or height. Okay, so if we are going up towards the mountains or we are flying in the aeroplane, then we'll feel the decreasing in the barometric pressure. And when we'll go to depth of an ocean, that is otherwise known as Caissons work, then we will feel the increasing in the barometric pressure. So there is a relation that if we will go 10-meter depth or we will go 10-meter diving, then there will be increasing in the barometric pressure by 1 atm or 1 atmospheric pressure. This is a correlation that we should remember. Okay, now we are going to see how this increasing in the barometric pressure causes the pathological action and what is the mechanism of action. This Caissons works, or in this topic the most important question is this Caissons disease, how this Caissons disease occur and what is the mechanism of action. This is the important questions asked by most of the teachers, and also it is important for Croc. So the mechanism of barometric pressure increase. According to the change in pressure, the properties of gases changes that we know from previous video. So what will happen if there will be increasing in the depth of the diving? As the depth increases, there will be compression of gases. Previously, when we are climbing up, there was expansion of gases, but here there will be compression of gases. It means the gases will try to solidify, or the gases will be having highly soluble property with compressed action. Then secondly, what will happen? The solubility or the dissolving capacity of gases will increase. So these two effects occur due to the change in barometric pressure. Firstly, there will be compression of gases. Secondly, the solubility increase. Due to this compression of gases, what will happen? The tympanic membrane will become stiff. It will become hardly stretched and it will become stiff. And secondly, the intestinal gases. Our body feels heavier when we move inside the depth of the ocean. This is the reason, because there will be compression of intestinal gases and we feel much heavier. Then what happens? There will be squeezing of the blood vessels in the periphery, not in the central of the organs, but it occurs in the periphery to reduce the blood pressure. Then this process will result in increasing of the blood filling in the inner organs. As there is decreasing of the blood supply to the periphery, the inner organs will get much amount of blood, and at a sudden instant when there will be sharp increasing of the barometric pressure, at that time there will be a rupture of our alveoli. That is nothing but called as this barotrauma. So due to compression of gases, there will be barotrauma. This is the ultimate result of the increasing in the barometric pressure. Secondly, as the solubility or dissolving capacity of gases increases, there will be causing a phenomenon that is known as saturation of gases. Saturation of gases, like the gases that are present in our blood vessels, that is nitrogen and oxygen, their amount or their saturation will increase. Saturation means maximum amount of a substance. This dissolving property as changes, it will cause this toxic behavior. As we know, excessive of anything causes the toxic activity, like in that same manner, due to excessive saturation of gases will lead to toxic behavior. And if this excessive saturation is not maintained, then it will finally cause this Caissons disease. Before going to Caissons disease, I want to explain you about this excessive separate gases toxicity. Like if there will be excess of nitrogen, what will happen? There will be the nitrogen will perfectly get dissolved in fats or lipids, and the most fats are present, or the lipids are present in this brain yellow bone marrow. What cause will occur when it is excessively saturated? Initially it will cause this narcotic effect. It is like amusing effect, means it feels good for the uh, diver. Secondly, it will cause the toxic effect, like there will be headache, dizziness, hallucination or motor dysfunction. Secondly, what will happen if there will be excess of oxygen saturation? As our body requires oxygen in a normal amount for performing its metabolic activity, but as the oxygen will be provided in excess quantity due to the dissolving capacity, so the tissue uptake will increase. Tissue will primarily take those oxygen available. Due to that reason, the hemoglobin will not be able to take the oxygen and the hemoglobin will be blocked. And finally, it will lead that as the tissue is taking enough amount of or more than enough amount of oxygen, the carbon dioxide will not be transported by this hemoglobin, and that is the reason why it will lead to cause this asphyxia condition. Okay. Secondly, the high concentration of the oxygen, it will lead to free radical oxidation. This free radical, what do you mean by this? The free radicals are nothing but the highly inconsistent and highly dangerous for our cells tissue. They will try to perform the chemical process, that is oxidation or breakdown, and that will finally lead to cell injury. As we know, this free radical is unstable. Now comes this Caissons disease. Listen, this whole process occurs when the divers go into the depth of the ocean and performs its work, that is known as Caissons work. After finishing the Caissons work, what happens? The divers try to come to the upper level or up surface of the sea. During that process, what will happen? As the diver is moving from down towards the up, that means from high barometric pressure to low barometric pressure or normal atmospheric pressure, then the saturation or dissolving capacity of gases like nitrogen will decrease. Due to this decreasing of the gases solubility, the gases like nitrogen will try to escape from the blood or the body fluids, and they will cause some kinds of bubbles in the vessels, and they will try to escape from our skin, due to which we see some kinds of bubbles on our skin, and that causes the Caissons disease. So that phenomenon occurs when there will be quick desaturation of oxygen. Saturation means there will be increasing in the solubility capacity, and desaturation means quickly the nitrogen try to escape from the blood vessels. So this is the reason why the Caissons disease occurs mostly. For the prophylaxis of this whole process, the divers need to have the gradual decompression method for avoiding the Caissons disease. So the decompression should be performed gradually, so that the change in pressure from high barometric pressure in the depth of the ocean to the low barometric pressure on the top of the ocean will not affect causing this Caissons disease. Okay, so this total was the effect of barometric pressure, and here we have completed the second topic of the changing barometric pressure. Okay, I hope this video will be helpful for you. Thank you for watching my video.